Good afternoon, everyone, and welcome back to Platinum Unplugged. I'm Dr. Emily Abear, and this is Dr. Michael Chapman.
Hello.
And we are going to be covering some more COVID topics for you today, several of them, in fact. And I'm going to let Dr. Chapman start off with some very interesting graphs and a lot of data that I think it's important for everybody to know about.
Absolutely. Well, let's just kind of get a bird's eye view of what's been going on here in the Dallas area. First of all, let's take a look at the Dallas County trends, and then we're going to kind of move and look at statewide trends. Unfortunately, since Memorial Day, as we showed you last time, we've started to see an uptick in cases, and that has proven to be the case. You know, as of Memorial Day in Dallas, we were at 190 cases a day, and as you can see, the upward trend, and on June 28th, we were at 561. On this next graph, this is number of infected people per 1,000, and you can see on Memorial Day, we were at 3.36 per 1,000, and that unfortunately has increased to 7.17 per 1,000. And you know, it's interesting when we see the breakdown of these infected people. 3% are Asian, 9% African American, 60% Hispanic, 8% white, and 20% are not reported. So it's really hit our Hispanic population very hard. So on this next graph, I want to take a look at the statewide trends. So on the top there in the red dotted line is projected number of cases, and I want you to pay attention to the green line below, which is universal mask wearing. So as of July 1, statewide we're projected to have 10,631 cases per day. Had we been wearing masks universally, that would have been 6,768. Now let's kind of fast forward to take a look at September 1, because we can still improve. With our eased restrictions and not wearing masks universally, projected we're over 27,000 reported cases statewide. If we all do our part in wearing a mask, that number could be as low as 2,900. And so that's a big difference of just a simple piece of having a cloth over your mouth.
Absolutely. I mean, several of the counties in Texas, especially surrounding Dallas, have instituted mask mandates. Collin County is probably the only one that's close to us here in Dallas that is lagging behind. I think the mask mandate is extraordinarily important. If you look at the data about wearing a mask and transmission of COVID, your risk of getting COVID if you are exposed to someone that has it, if they're wearing a mask and you're wearing a mask, drops to 1%. If you're not wearing a mask, that transmission rate is approaching 75 to 80%. And so there's a significant reduction in the transmission of COVID when we're wearing masks. And again, it's important for those that may have been exposed to stay home. They shouldn't even be out wearing a mask. But if we're all wearing a mask, even if we've been inadvertently exposed and we're asymptomatic, again, that is going to decrease that exposure to those around us. And so it seems like it can be an imposition and a bit of an inconvenience, but I'll tell you, I mean, Dr. Chapman and I have to wear a mask pretty much from when we get to work in the mornings and until we leave, and then any place else we go afterwards.
Except when we're filming.
Exactly, except when we're filming, and in the car. I take it off in the car. But I think it's so important, and it will slow the spread, and it will protect the most vulnerable in the community. And that I'd like to touch on one of the statistics that Dr. Chapman mentioned, and that's our Hispanic community in the Dallas and in Fort Worth and the surrounding counties. I think it's important to note that a lot of those people are the critical infrastructure workers. So they're the ones that are doing a lot of the stuff that we have to have done on a daily basis. And if we can, again, wear our masks and protect them from getting COVID, I think that's just a small thing for us to do to help out our community and our brothers. So.
Absolutely.
Yep.
So, you know, there's been a lot of talk and a lot of questions on vaccines. When are we going to get one? You know, earliest projection, maybe the end of the year, early 2021. But what I wanted to move towards and talk about, just kind of brief everyone on today, is treatment and what is out there. And there are some promising treatments under trials right now. One is actually a monoclonal antibody. And you know how they're taking the plasma from infected patients or those who have cured and giving antibodies to those infected in the hospitals. This is a monoclonal or synthetic antibody that targets the spike protein on the SARS-CoV-2 virus, and it prevents the entry into the human cell. So the first phases of the study were very promising, and people were being cured, and it's now moved into a larger scale, and hopefully ready for release and production as early as September,
That's
which
exciting.
would be a
Absolutely.
real game changer there.
Yep.
So,
Just in time for school,
yes.
hopefully.
Mm-hmm. So why don't we move on to what do you do if you are exposed?
Yeah.
That's a lot of phone calls regarding
Yes,
that.
of course, because as the numbers soar here in Dallas, we have people getting exposed left and right. I think it's important to, number one, clarify what the CDC feels like a close contact
Mhm.
exposure is. And so if you've been in close contact with someone, that is someone who has known COVID. Neither of you were wearing masks. You were within the 6 feet of separation, that 6 feet of distance between one another, so you weren't 6 feet apart. You had been around them in the 2 days prior to their diagnosis, and you had been around them for more than 15 minutes. And so it all sounds very specific, but these are all numbers that have been studied, and we've shown that all of those criteria, when they're met, make you at high risk for having contracted the virus. Unfortunately, a lot of times this happens after the fact. We realize later that we were around John Doe 2 days ago, and now they're positive, and so what do? Well, even if you don't think that the person that you've been around was technically a close contact, I think you should still call us and we'll walk you through it. We'll walk you through what we think your real risk is of having contracted the virus. And then we'll talk about what we do next. Do you get tested? Do you stay home? Are you having symptoms and need more emergent medical care? I think that first phone call is going to be the most important, because that way we can triage you according to what's best going to fit what you need to do. I think something that's extremely important, and that we've been trying to get across to our patients and our family members and our friends and the community as a whole, is that if you think that you have been exposed, the most important thing you need to do at that point is to stay home. You must self-quarantine until you are told otherwise. And unfortunately, the acute COVID testing is a little bit dicey. There's some timing of the test that can be tricky. But if we really feel like you've had a good exposure to COVID and we do the acute testing, or you even get the acute testing, the nasal swab, outside of Cooper, and it's negative, but we still really feel like you got exposed even if you don't have symptoms, we're still going to ask you to quarantine at home for 14 days. And that is per CDC guidelines. They want these folks staying home and self-quarantining, because the testing, although good, isn't perfect. And then, of course, there's other quarantine guidelines if you're symptomatic, if you test positive. But those are all things that we would prefer to walk you through and discuss one-on-one, so that we know we're all on the same page.
Mm-hmm. Absolutely.
Yes.
And another thing to bring up is just, if parents and grandparents, talk to your kids, your adolescents, your teenagers, your 20 and 30-year-olds, because that's really where we're seeing an increase in the number of cases right now.
They're miserable and they want to go out, but
Right.
as Dr. Chapman said, it's important to communicate with them.
Just wear a mask when you go out.
Absolutely.
We've had that discussion multiple times.
Yes, same.
All right. Anything else you want to bring up?
I think one of the other things that you touched on was on in terms of treatment, still a lot of information and misinformation out there about the other treatments that have been out and about for a while before the monoclonal antibody and the vaccines come down the pike. Hydroxychloroquine, none of the studies have been conclusive. So for now, that is not a medication that many hospitals are using. And certainly we wouldn't prescribe it, just based on the data that we've read and the inconsistent stories that have come out about it. Decadron is the newest medication that's been discussed in the news. That is for hospitalized, critically ill patients only. So again, that is not something that we would give anyone preventively, or even if you had a COVID positive test with mild symptoms. That's being reserved for the sickest of the sick that are in the hospital with that cytokine storm. And then the remdesivir treatment continues. Again, they're still amassing data, and I think hopefully as we continue along with that, we'll get more positive information out of it.
Yep, I agree.
Yeah.
Okay. Well, that's going to be our shoot for today.
Okay,
and
great.
Please send any questions in that you'd like for us to address, and we will definitely get in touch with you to address them.
Wear a mask.